What does a low FSH level mean for my fertility? Have you ever wondered what a low follicle-stimulating hormone level means for your fertility? Understanding this hormone's role can be quite helpful, especially if you are facing fertility challenges. Follicle-stimulating hormone, or FSH, is produced by the pituitary gland and plays a crucial part in the reproductive system. Its main job is to stimulate the growth and development of ovarian follicles, which are responsible for containing eggs. The level of FSH in your blood can provide important insights into your reproductive health. When FSH levels are low, it generally indicates that your pituitary gland is not sending strong signals to your ovaries to develop follicles. This situation can arise for various reasons, including being on hormonal birth control, being pregnant, or having certain medical conditions that suppress FSH production. Interestingly, low FSH levels are not usually the primary concern in fertility discussions. Fertility specialists often focus more on high FSH levels, which may indicate diminished ovarian reserve or that the ovaries are not responding well to signals from the brain. This is often seen in women approaching menopause or experiencing premature ovarian insufficiency. For many individuals, low FSH levels do not directly link to infertility. Instead, they may reflect that your body is not currently in a phase that requires stimulating egg development, such as during pregnancy or while using hormonal medications. However, consistently low FSH can sometimes indicate issues with the pituitary gland or hypothalamus, which are parts of the brain that regulate hormone production. If these areas are not functioning correctly, it can disrupt the entire menstrual cycle and ovulation, potentially affecting fertility. Now let's consider endometriosis. This condition does not typically cause low FSH levels. Endometriosis occurs when tissue similar to the lining of the uterus grows outside the uterus, often leading to pain and sometimes infertility. The main fertility challenges associated with endometriosis are usually related to inflammation, scarring, or anatomical changes rather than hormone levels like FSH. However, if endometriosis is severe or has led to complications affecting the ovaries or other reproductive organs, it could indirectly influence hormone production and regulation. In summary, a low FSH level is generally not a primary cause of infertility. It may indicate that your body is not currently trying to stimulate egg development, or it could point to an issue with the brain's regulation of reproductive hormones. For those dealing with endometriosis, the main fertility concerns are typically related to the physical effects of the disease rather than FSH levels. If you have concerns about your FSH levels or fertility, it is crucial to consult with a healthcare professional. They can interpret your hormone results in the context of your overall health and medical history. Practical steps for monitoring fertility include regular hormone testing, tracking menstrual cycles, and collaborating closely with a fertility specialist. This proactive approach can help identify and manage any underlying issues effectively. Always seek personalized medical advice, as fertility is complex and influenced by many factors beyond just hormone levels.